The time being 9:02 a.m. on May 18th, 2022. I'd like to call this meeting to order of Kane County's Public Health Committee. Clerk, please call the roll.
Lewis,
Lewis here.
Shepro,
Present.
Strathman,
Strathman here.
Pepe,
Deppie here.
Wallace,
Sorry, Wallace is here.
Silva,
Silva's here.
and Sanchez.
Sanchez is here. Okay, if someone could ask unanimous consent to approve the minutes of April 20th, 2022.
Shepro so requests.
I heard Tepe first. Any objections? Hearing none, the minutes are approved. Finance and budget, does anyone have any questions for Cannell on this month's Health Department Finance Report? No questions? All right. Public comments on agenda items. We don't have anyone here in public, in person. I don't see anyone online I don't recognize, so I'll assume we have no public comments. We'll move on to the Executive Director section. Kathy Foster.
Can you hear me? Yes, okay. Kathy Foster, Interim Executive Director. And today, Ms. Uche Anwuta, the Director of Health Protection, will be presenting on COVID-19 updates.
Good morning. Can you hear me?
Yes.
Yes.
My name is Uche Omuta, Director of Health Protection at King County Health Department. And today I'll be presenting the COVID-19 update for May 18, 2022. Okay, so last meeting we were at low community level. As of today, we are at medium community level. Our number of cases per 100,000 shot up from 81 per 100,000 to 308 per 100,000 in 1 month. And our new COVID hospital admissions are up to 6.1 per 100,000. 2.2% of our staffed inpatient beds are in use for COVID-19 patients. That also went up. And that's what brought us to medium community level. Total number of cases so far, 132,683. Total number of deaths, 1,127. The hospital admissions and inpatient beds are relatively lower than what we saw in previous surges, but suffice it to say that we're on the upwards swing. So what does CDC recommend for communities at medium level of transmission? Most important is to stay up to date with COVID-19 vaccines. If you have symptoms, get tested. If you test positive for COVID or have been exposed to someone with COVID-19, we ask that you wear your mask if you have symptoms. And then wear a mask on public transportation. It's still the law in Illinois. You may choose to wear a mask at any time as an additional precaution. And we ask that people respect those who choose to wear masks. If you're at high risk of severe illness, consider wearing a mask indoors in public and taking additional precautions when needed. And since it's been a long time that we have high incidence of COVID, I thought I would add this, for what those additional precautions are. we talked about staying up to date on vaccination, wearing masks, but also, oh, sorry, it's the next one. I didn't include that. Okay, but additional precautions will include, for instance, making sure that ventilation is good in the home, washing your hands often. Okay, yeah, that's in there. Washing your hands often and avoiding crowds and poorly ventilated spaces and testing to help prevent spread to others. Testing is really key in this situation where a lot of people are no longer wearing masks. So just looking at where we are with our cases, you can see that, okay. So this was where we were in December, January, the high surge that we had with Omicron. And then we were enjoying low cases and all of a sudden we're swinging up. So this is where we are as of May 13th. And looking at the age distribution, you can see that other than the elderly, most of the other age groups are kind of about the same distribution. So this is the chart about variants. We started off again with in January we had Omicron BA1, and then slowly BA2 came into the picture and has pretty much dominated. But look at BA2.12.1 is coming up, and in other places they've had more of the BA2.12 than we have, but at least it's still in the picture. Of course, they're all part of Omicron. We just kind of pull them out to show you what is in the community right now. And just to remind you that we don't test all COVID cases for variants, so we could have much more or much less in terms of proportion, but these are the ones that end up mostly, those who are hospitalized, and a certain fraction of total cases submitted get sequenced. And this is pretty much showing you the same thing. Down here, BA2 in for specimens submitted late April, early May, 100% BA2. And this BA2 includes the BA2.12 and the BA2 and other sublineages. Vaccination, we're still slowly crawling up with 68% of total population vaccinated, 51% currently with the first booster.
All right, very good. All right. Vaccination rates are good.
Okay, so sorry about that little picture in the wrong place. But essentially, what to do, yeah. Let's see. When to take a self-test. You should test immediately because everybody received the home test kits. And although we have a surge right, oops, I'm sorry. Although we have a surge right now, a lot more people are testing at home and we're not catching them in the number of cases that are reported, because if you test at home, you're not required to report. So it's important for us to let people know what to do, when to take a self-test. So if you have COVID-19 symptoms, you're asked to test immediately. If you were exposed to someone with someone with COVID-19, test at least 5 days after your exposure. And if you're negative, consider testing again in 1 to 2 days. And then if you're going to an indoor event or a gathering, you're asked to test immediately before the gathering or as close to the time of the event as possible. So especially in gatherings that includes individuals at risk of severe disease, the elderly, and people who are not up to date on their vaccines, and children who have not been vaccinated yet. So I say this because we have graduations, we have Holy Communion, confirmation, and all kinds of events around this time. So just to advise that people use their home test kits and get tested before they go. And if you test positive, you stay home. So again, just to remind you that everybody 5 years and older should get vaccinated. Thank you.
Thank you, Uche.
Question, Shepro?
Mr. Shepard, go ahead.
I know that the hospitalizations are up. Do we have any information on the severity of the hospitalizations, length of stay, et cetera, compared to last month or the previous month? I mean, what I hear anecdotally is that while more people are getting sick, generally they're not severe or life-threatening situations. And I was wondering if there's any data that gives you any clue one way or the other.
So when people do test positive, we're seeing people experiencing mild symptoms. Those who have symptoms that are severe enough to get hospitalized, I would think that anybody who gets hospitalized is one that the physician has deemed serious enough to spend a night in the hospital. That's what we're capturing in that 6%.
But like, are they literally like spending a night or two and going home, or are they extended stays? Or don't we know yet?
We don't know that.
Yeah. Typically this is Laura Barrett from the Health Department. Typically those numbers and that data on length of stay is about 90 days delayed with CMS, and that's just your Medicare, Medicaid population. So that takes about 90 days after to be able to gather that and show that data.
Is the 6.1, that's current, or is that also really a 90-day look back?
6.1 is current.
Okay. And if there been, what is the latest? I saw the total cumulative death count. What has happened in the last 30 days as far as new COVID deaths?
I don't have this. I don't have it on this one, but I can get you that information.
Not much though.
Yeah.
Is that significantly changed or up, down?
Well, deaths are beginning to trickle up. You know, the experience we have with COVID is the number of cases start going up, and then the number of deaths go up about a month later. But they've started going up.
Thank you.
Any other questions for Uche on the COVID report? Mr. Brown.
Brown speaking. I don't know if now's the time to ask or not, but what are the plans for the vac site? Is that still closing the end of the month, or?
Well, we have our contract, the lease goes until the end of May.
Right.
And we've been working on getting in touch with the owners to find out if we can extend it another month. The idea being some PEDS doses may be coming through and we can get a start on that. But other than that, if we're not able to extend it, we'll be exiting. If we are able to extend it a month, we'll exit at the end of next month.
Thank you.
Any other questions? Okay, let's move on. April statistics report, that's the COVID. That's the COVID, right?
Okay, so this is a general statistics report. And we used to have these statistics before, and I thought, because when we had done a survey, there were some that were interested in seeing the monthly statistics. We had them on our website, but we just thought we would bring them here. So that could change, but I figured we'd start doing the monthly King County Health Department statistics to bring forth. And then if you had questions, we could answer them. So.
Any questions on this report that anyone has? Is there anything notable that you can think of that we should be looking at in particular?
I don't believe so, unless Uche, was there something?
I think so.
Corinne, do you have a question?
Thank you. Yes, Jared. Hi, good morning. I'm looking at it online, obviously, and I am getting my glasses on, but there's so much data on there that it's hard to consume just at this meeting. Is there a way that you could put it in a more usable format, put it in a graph, so that we see baseline, and then if there's any spikes in any of the issues, those can be addressed at the monthly meeting so that we know that there is an issue, something is going on, or something is very positive that it's going down. For instance, I took the dog out for a walk and ticks are out of control in the forest preserves. I mean, they are out of control. They're more ticks that I've ever seen. And that could be a possible issue. So you know what I'm saying? So like typhoid fever, there's no typhoid fever at all.
Yeah, I think highlighting relevant and important trends would be good.
Yeah, thank you, Madam Chair. I can respond to that. What we have here is we have the monthly reports, the year to date, and comparing with the previous year. And when we do have spikes, we bring that up. The reason why we posted it on the website and it hasn't been part of the reports is that we usually, inform you when there's something important to discuss. But these are kind of like the regular. We're required to report these numbers on a regular basis. So
Sure.
that's all we have.
No, which I truly appreciate all that and respect this. It's a very important report. But what I'm saying is just for public consumption, if there are any issues that could be put in, perhaps maybe some sort of a chart that could be more easily consumed and understood by the board, by the population, with this as an attachment to be able to drill down a little bit more if needed.
Sure, thank you.
Okay, comment, Shepro?
Go ahead, Shepro.
Yeah, I agree with Madam Chair's observations. I think this is a useful additional information to have. But for example, I'm sitting at home and I can't really read any of it. And to Chairman Sanchez's comment, I think if there could be even a very brief sort of narrative about, are these within past history? Is there anything that should be called out? I think it's really good to have this information, but there, in a way, if we don't know what to make of it, it's hard to figure out what to make of it. So I did have well, no, that's it. Thank you.
Thank you, Mr. Shepro. And for anyone listening now online or later online, the agenda packet on the website for this month's Public Health Committee does contain this chart, as well as all of the other reports that we have. So thank you, Kathy, for putting those on this month. And to your point, Mr. Shepro, I'll work with staff to put together something that is a little more absorbable for public consumption. But I think these reports are still good to include in the agenda packet themselves.
I agree, and thank you.
Any other questions or comments? Okay, we have a resolution. I'll ask for a motion in a second to discuss and potentially approve authorizing FY23 overdoses surveillance grant contractor. Anybody want to?
Shepro moves or seconds, whichever.
Lewis' hand went up. I heard Tepe. It gets the second. Shepro, you can get the next one.
Thank you.
Who's presenting on this one? Mr. Isaacson.
Yes, good morning. This is Michael Isaacson, Assistant Director of Community Health. The resolution before us is representing grant funding that we have from the Illinois Department of Public Health. This is a grant that we do expect it comes down from the feds, so we expect it to be coming for several years. And what we're looking to do here is really get a better handle on the data that includes risk factors and where we're seeing overdoses. So as we look at, and we actually just had a conversation with a group in Aurora yesterday looking at gun violence, as we look at the different sources of data that we have, we realize that some additional assistance would help us to pull things together and be able to map it better. So with this, we're looking to hopefully partner with an institute of higher education where we could get one or multiple students along with a faculty member to be able to really put together a robust look at opioids and the risk factors that lead to opioid use and unfortunate overdoses.
Excellent. Any questions for Mr. Isaacson? Excuse me.
Shepro again, quick.
Shepro, go ahead.
Mike, I think I've seen in the last few days reports that suggest that opioid deaths reached another all-time record.
Yep.
Yes.
And I wondered if you had any observation about that, causes, effects, how that interfaces with some of our other data about the resurgence of COVID, et cetera.
Yeah, absolutely. And the big driver for that is, of course, fentanyl. So maybe that's something that at one of the upcoming meetings we could talk about. I know board member Lewis hosted a fantastic event in St. Charles. Was that just last week? That had a good crowd and shared a lot of information. So with fentanyl being a much more potent drug that is involved in the majority of the deaths, and actually I have spoken before about how we were waiting on the coroner death. We just got the 2021 full death report. So our epidemiologist is working right now for suicide, for homicide, and for overdoses to put the full report together with all the demographics and where those are occurring. What we're seeing is an increase in the percentage of overdoses that include fentanyl. So fentanyl being a synthetic form that's included and cut into a lot of drugs, including things that we are not opioids. So typically we would see somebody who's using an opioid and they may overdose because there's fentanyl in it. Now we're seeing fentanyl in cocaine. We're seeing fentanyl in other pills that are being pressed. And there's many people who typically would not report that they use opioids, and they may not use opioids, and they may use another drug, and it may have fentanyl in it, and their body may not have any tolerance for that. So we see an increase in overdoses from that. So the sheriff's office, and I think I've spoken to this before, the sheriff's office has some great aggressive programs to really help people. The state's attorney's office with the pre-arrest diversion program. We're very active trying to get out there and do education and provide naloxone, which of course is the medication that can reverse an overdose. We are monitoring how much naloxone needs to be administered because fentanyl is so powerful. We're seeing and hearing anecdotally that there may be more doses of naloxone that need to be provided to somebody who's in an overdose. But the simple one-word answer to your question, Mr. Shepro, is that fentanyl is driving all of this.
I just, my family had a personal experience about a year and a half ago with a fentanyl-induced death, and just listening to your answer makes me think that this is really something that is maybe an interdepartmental issue. I mean, law enforcement, the coroner, the health department. I think it's a very alarming trend that doesn't seem to be slowing down. And I know you folks have an awful lot to do. I think at a future meeting, I think it would be very important to get the word out to us and to the public about just how this is taking off, because it does seem to be no respecter of ethnic groups, economic groups, or anything else.
Yes, agreed.
Madam Chair, you have a question?
A comment to follow up on Mr. Shepard. He is spot on, and it's a countywide issue. It impacts all demographics. But one of the things that we did see is that the average overdose of fentanyl is not our young people. It's a white male who's approximately 35 to 42. Those are the individuals who are being greatly impacted by the fentanyl crisis with the overdosing and related deaths. So I think it's an impactful opportunity for us to further discuss. And I would certainly support meeting at the committee of the whole, perhaps sometime in June or July, when we can pull it together to give a staff an opportunity to do an in-depth presentation and then recommend next steps if the board so chooses to move forward with that. And it'll be personnel and funding, and also just education, primarily education and outreach. So absolutely, Mr. Shepard, thank you so much for sharing your story. It's greatly appreciated.
Ms. Lewis.
Hi. So Michael mentioned the forum on fentanyl that we did last month. I got a notice this morning that we had that professionally videographed because we knew that information was super important to get out there, and we did have good attendance. So I got the note this morning that will be available later today, and I'm going to make sure that gets to the Sheriff's Department, the coroner's office, to Michael's group, to everybody and anybody who attended the forum, and anybody that's in any way, shape, or form has anything with this, and it's going to be available free to everybody, because to Ken's point, we really, really do have to get this word out, because just like you, Ken, we had a death in our family that we had no idea until the coroner's report came back. Fentanyl was the cause. So we just don't know what we don't know. So we've got to do a lot of education. So just want to throw that in there.
Thank you. Thank you.
When you get that provided to you, can you send that to the county board or have it sent to the
Yes,
county
I can
board?
send that to anybody who wants it. And I will. I'll send it to the world, if you know.
Because it truly is a countywide issue.
Oh, yeah,
So
absolutely.
all of our board members should be apprised
Yeah.
of the information that we have. Madam Chair.
I would suggest that Ms. Lewis sends it to Julie Mann, and she'll make sure it gets onto the proper channels.
Perfect.
Okay.
And just one additional thing we have in consultation with the coroner's office and the sheriff and Madam Chair, we have started to provide fentanyl test strips to the sheriff's office and to some of our other providers. So this is something that people who are using drugs can actually test to make sure that they're not being surprised, because being surprised may mean losing your life. So this is, we move into some things that are considered harm reduction, which are really critical evidence-based things that we can do to save lives here in Kane County. And I've said it before, but I think now is just a really fortunate time with the people we have. And as Mr. Shepro said about this being interdepartmental, it's absolutely true. We work very closely with the sheriff's office and the state's attorney's office and the coroner's office on all of this. And we need to keep trying new things to save lives because we're going the wrong direction right now.
All right, any other questions or comments on this resolution? Okay, I think we're ready for a vote. Clerk, please call the roll.
Lewis,
Yes.
Shepro,
Shepro, yes.
Strathman,
Strathman, yes.
Pepe,
Happy, yes.
Wallace,
Wallace, yes.
Silva,
Silva, yes.
Sanchez.
Sanchez, yes. Okay, animal control.
Good
Yeah.
morning, everyone. How
On
are
the
you
line?
today?
How you doing, Brett?
Very good. Sorry I missed last month. If I could just review some stuff, I was listening to the meeting notes from last month because I like to catch up on everything. Just a reminder, I respect 100% whatever the board wants to do with this department, and wherever the board feels this department is best suited, I support it 100%. I just want to make sure we don't lose sight of two of our big missions. Number one is rabies tags. That is 90% of our budget. That is our number one mission, as designed by the state of Illinois, was the disbursement of those rabies tags, ensuring animals are registered and vaccinated. Part of the reason we do those low-cost clinics. The number two mission is bites throughout King County, which is also linked through rabies. This state of Illinois takes rabies very seriously, and the way they designed their animal controls was to continue that mission for rabies. So I just want to make sure that rabies is not lost, as that is our main objective throughout the county. And then number three was, of course, strained dogs in unincorporated King County. For this month, I don't have too much to report. Our expenses were under our revenue, which is where we want to keep it at all times to make sure we're still doing well. We do have the 3 remaining vaccine dates. We're very proud of that. So far this year, we've completed our first 2, our April and our May clinic. We've vaccinated 105 dogs, 29 cats, and we've done 17 microchips, which is great news. We have a lot of repeat customers that are coming back. It's great to see them every year and know that their animals are very healthy. Our final 3 days have been posted, and we're going to be working with Julie Mann to do a large social media push to some of our northern partners in this county, as we really want to work to get some of the people up north and down south that we haven't been reaching. So she came with some great suggestions that we're hoping to utilize and try some different pushes to get that out. So we're very excited to push these remaining dates through that method. And we'll probably be doing that in the next month or 2 to start working with her to get that done. I am available for any question you need. I am always here. And other than that, I just have a resolution.
All right, any questions for Brett before we go to the resolution? Ms. Lewis?
So, Brett, I see that dog bites are up this year. Is that because everybody got dogs during COVID and they're not well trained, or?
That's always part of it. The other thing is, as we come out of COVID, more animals are out straying. Numbers did dip a little bit. As we went into COVID the first year, they started to rise a little bit the second year, and now we're kind of getting back into it. Every year, bites do seem to go up as people seem to forget what they should and shouldn't do with their animals. But there are always so many different reasons. We've had warmer days also affects it very much, which also leads into something the chairwoman said. Madam Chairman, you are correct. Ticks are estimated to be up this year. Everything we're reading, everything we're seeing is doing the same. We know some press releases have been already put out, so we'll probably wait a little bit and then push another one out ourselves. Through Julie Mann, we'll work with her to make sure that gets out, because yes, we are seeing the same exact thing you saw as you were walking your dog.
Thank you.
Mr. Kenyon?
Thank you.
In Mike Kenyon, in our neighborhood, we've seen a couple raccoons that are acting strangely. They don't usually see them in the middle of the day. And I understand that they have distemper. So that could be a problem for many other animals in the county, dogs, cats, whatever. Just something I don't know if everybody communicates with each other.
We do hear all that data, and I thank you for bringing that up. If you do see a raccoon or a skunk or a possum in your area that is not acting correctly or is not really moving, we recommend, if you're in the municipality, call your local police department to call us to give us permission to pick it up. If you're unincorporated, call us directly. It's also the time of year we'll start seeing that a little bit more. Avian influenza went through a large batches of birds about a month ago. We heard from our wildlife people. And now we just received some stuff from IDPH. They're wondering if the fox kits ate some of those. Those are the brand new little fox cubs that are really cute. They're starting to show some neurological signs. So what I recommend is do not approach. Contact your local jurisdiction. If you're unincorporated, contact us and we will come take care of that for you. Because again, our goal is to keep everybody as safe as possible. We don't know if it's rabies. We don't know if it's distemper in the raccoons, but we do make sure we come and handle that appropriately.
Thank you, Brett. I think that's a good point. A lot of people think animal control, no matter where you live in the county, you call them, they come and get the animal. And it's not quite the case. If
Good
you're
luck with that.
unincorporated, that is the case. But if you're in a municipality, contact your local police department, encourage them to work with animal control. And then animal control does what they do. So
Correct.
it's just a misunderstanding we have of animal control. I know that's how it was when I grew up in Dundee, and we'd see a raccoon in the road and somebody'd call animal control. I said, we're not doing anything about it, you know? You're in East Dundee,
That's
buddy.
government at its finest.
Mr. Chairman, this is working.
Ms. Bates.
Do we know when we can put our bird feeders back up?
I don't, does anyone here know about that? I
The
recall
recommendation has
correctly, it
been
was
after
for a
May
month.
31st.
After May 31st.
After late Memorial Day is what, and they were going to reevaluate the end of next week to see how how it was going at that time. That's what I heard.
Yeah. Yeah, that's what I recall too, the month of May.
Hard to hear.
Yeah.
Question, Shepro?
Mr. Shepro?
Would that be applicable to people that aren't using feeders but put bird seed out in large quantities just for birds? Would the same recommendation hold true?
I'm not aware of that. I think it's the feeders. There's more contact and shared surfaces.
And
that,
just a quick follow-up to Mr. Kenyon's comment. Is there any usable data about among the wild animals, raccoons, et cetera, of increases in distemper or other contagious diseases? Or it sounds like the answer was not enough to really draw any broad conclusions.
We usually hear our feedback from the state. We do not test here. The state does not require that we submit anything to them or submit any requirements. Their recommendation is proper humane euthanasia and proper disposal, which is what we follow. The only thing they're surveillancing still is skunks, and that's because skunk rabies down south is so prevalent and it's becoming more and more. We surveillance it here in Illinois. So we send about 10 to 15, rough estimate, skunks per year. And so far, Illinois has tested negative for skunk rabies. But that is the only thing that the state has us testing for at this time from our side.
Thank you.
Skunk rabies. Sounds like the name of a punk rock song or something.
Yeah.
Or a punk rock group.
Or group, that's what I was thinking.
Need to start one. We do have a resolution for animal control. If I could get a motion in a second to.
Jepro moves this time.
Essentially approve
Silva seconds.
resolution 22-06 Metro West Animal Control Renewal. I think we had Shepro and Silva. Any questions on this? Brett, did you want to say a couple words about this?
This is a renewal of our municipality's contract. Yeah, we renew it about every 3 years. It's a 1-year contract with 2 one-year renewals after that, so it lasts for about 3 years. The only big changes this year are, unfortunately, with inflation, prices have gone up. But again, this isn't a profit for us. Our goal is to just charge back what it costs the county to do these services. So it's kind of, we put out $10, we're asking for $10 back sort of thing. We're not trying to, we're trying to work with the municipalities as much as possible. And it really is a stray holding animal contract. And municipalities are still responsible for their own animal controlling. We handle unincorporated, they handle city limits. This contract was designed and put in place that if they need assistance, we're there to assist, but we're not there to fully run all their animal control services for them.
Any questions? Okay. Clerk, please call the roll.
Lewis,
Yes.
Shepro,
Yes.
Strathman,
Yes.
Pepe,
Pepe, yes.
Wallace,
Wallace, yes.
Silva,
Silva, yes.
Sanchez.
Sanchez, yes.
Passes.
All right, resolution passes. Thank you for being here today, Brett.
Thank you so much.
Okay, we have nothing under old business unless there's a committee member who has something they desire to bring up for old business. Can I have someone ask for unanimous consent to place the reports on file?
Shepro requests.
Any objection? Okay, the reports are placed on file. No need for executive session. Nothing under new business. Oh, Ms. Lewis.
I just have a question that's, yeah, it's related to this. So we all know that I have a daughter that's, our granddaughter who is on, has anxiety and all kinds of issues and things. And she gets her controlled substances, which is mostly Xanax, through a telehealth doctor, which they allowed because of COVID. And now they're saying that as of October, they're not going to allow that anymore. And so my question is, do we think that when they don't allow this anymore, because we already have a mental health crisis, is this going to cause other issues like people are going to go black market and get more fentanyl? And we're going to have, I think we're going to have bad effects. I know that when she got to go to the telehealth on it, for the first time, she was able to get her controlled substances every month right on schedule. And I'm just really worried about that if we don't find a way to make this permanently legal, that we're going to have a lot more problems. Do you guys have any input on that?
I'll look into it for you. It was my
That's
understanding.
that Ryan Hyde Act of 2008.
Right,
It's a
right.
young man who died of a overdose because he had bought something off the internet. And so then they put in this law that said that telehealth cannot distribute controlled substances. And then they eased it during COVID, and now they're going to go back to it. So, but the world has changed a lot since 2008.
Yeah.
Changed a lot since 2008.
Right. Yeah, no, I know there's been legislation that's been pending to look at that. So
Okay.
I'll check in with folks and see where that was, because I thought they were going to expand that,
Yeah.
but I'll verify
Yeah,
if she's getting that notice.
Yeah,
that's-
her doctor told her yesterday. So, okay, awesome. Thank you very much.
All right, thank you. And make sure to send that video. The presentation, what, can you just briefly describe, because I don't think you described exactly what it covered.
Okay, so what it was we had Coroner Russell and Sheriff Hain and Nathan from Lighthouse Recovery, who does our jail pod stuff, and Dr. Stephen Holtzford, who is with the Recovery Centers of America and also with Lighthouse in our jail. And they walked through fentanyl deaths, first of all, and the trend. It was very interesting because Rob Russell started out saying that when he started in 2012, there was one death. And now there's, I can't remember what the number was right now, but it's like, you know, staggering. And then they went into treatments and where this is coming from and the history of fentanyl. And it's just super, super informative. And a lot of myths that we all had, you know, were expelled. And so it's definitely worth. And a bonus, the very last speaker was Madam Chair.
Excellent. Well, we look forward to the
Yeah.
recording.
Yeah, and like I said, we had it professionally done, so it should come out. And we made Sheriff Hain put the whole PowerPoint together for all of our speakers so that it flowed. And we know he loves PowerPoints, but they did a great job. So I'm anxious to look at it myself today and then get it out to everybody. So thank
That's how you got the sheriff
Thank you
to
for bringing it up.
take part in it, wasn't it? He got to do the PowerPoint. So he said,
Yes.
yes, I'll do
Oh,
it.
yeah. And those guys interact so
Jeffro.
well because to Michael's point, they all work together a lot. In King County, we really have some great collaborations. And you could just tell the respect of the four on the stage and the interaction that they have. And Michael was there, but he didn't want to speak. But he was our background guy, brought a lot of information, and we passed out a lot of literature to people and got a lot of contacts. So it was very good. And I think we're going to do it in September down at the south end of the county. So Aurora, North Aurora that way.
Excellent. Michael, were you going to say something?
I was just going to say, and thank you to the board. At the last board meeting, you approved just over $200,000 in grant funding that we made available to community organizations. So this includes working with Lighthouse, working with VNA Healthcare, working with the Ecker Center up in Elgin, working with our pre-arrest diversion program. There's a lot of really great projects in here. It's increasing access to treatment, increasing access to medication-assisted treatment, or it's now kind of changing to medication-assisted recovery, which is really where the evidence is that that's the best way to help people stop using opioids. So I just want to say thank you, because I think we have a lot of great projects that are underway right now.
Excellent.
Mr. Chairman, Allen.
Ms. Allen, go ahead.
Michael, thank you for that review. I suspect that you are out doing things all the time, and it's really helpful to have you come back in and tell us about them so that we know. And Anita, can I ask how many people came to that forum personally? Or you?
Yeah, I think there was about 100, which for a forum is really, really good attendance. We did it at the Arcada in St. Charles. And it was a Wednesday night and, you know, there's lots of things going on, but there was really good attendance. And people, what was interesting to me was they came from all over. This is so cute. We had an 80-year-old lady from Sugar Grove that drove up there for it because she has somebody in her family that she was concerned about. And then we had, you know, people from all over the county and even outside the county. So, and a lot of people that are in the healthcare provider and in schools and stuff like that. So it was really good. We'll be able to get the word out to a lot of people.
That is great stuff. I have a question. When your presentation is available, do we have the IT stuff where we could like post it on our website and someone could come and then watch it from the website?
We're gonna, when, after I get it today, we're gonna give it to, I know the sheriff's gonna put it on his website and the coroner's gonna put it on his, and, you know, obviously we'll get it to public health, and I'm guessing we can probably put it on, when I get it to Julie Mann, we can probably put it on the county Facebook page, or not Facebook page, but, you know, YouTube channel.
Terrific. Thank you. Thank you for putting that together for us.
Yeah, and if there's a media that we need to, you know, change formatting or something, that's why I had it professionally done, so that, you know, if we need it in a different format, we can do that too.
It's good thinking. Not everybody considers the quality of the recording, but
Well,
I appreciate that.
We knew that we wanted to share it with a lot of people, and so we wanted to make sure it was done right.
Question,
Which
Shepro?
would be me doing it.
The new iPhones are great, but it's different when you got pros.
Yes.
Mr. Shepro, go ahead.
Yeah, this was the forum on May 4th, right?
Yes.
Yeah, there's a good article in the Chronicle print edition from last Thursday, May 12th, and I think online as well at Shaw Media's website, that is an in-depth discussion. The headline is "County Leaders Speak at Forum Addressing Dangers of Fentanyl," which I would commend to anybody who wanted to take a look at the media coverage of the event.
Thank you, Mr. Shepro.
Yeah, thank you.
All right.
Shaw Media actually co-sponsored this with us.
Oh, nice.
And they did all the publicity and all the advertising they did for, I probably shouldn't say what it costs. I won't, you know.
Well, that's great. I'm glad it
Yeah.
all worked out. So
Because they, you know, they definitely understood the problem and were very, I don't know about excited to help, but very agreeable to help.
excellent.
I'll send the article around.
Please, that's great. Thank you.
All right. Any other questions or comments? Going forward, COVID has been a huge part of this committee's time spent in the past 2 years. And that's starting to dwindle and become a little bit more in the background. So just something I envisioned for this committee early on was that we would explore some of the other public health related topics that are relevant to our population. Obviously addiction is one, and harm reduction that we've already talked about, but also leading causes of death. You know, heart disease still remains the #1 cause of death. And, you know, it's just an example. So going forward, we do want to start bringing some more of that stuff into our committee meetings. And then also the Health Advisory Board. The county board is, through an act of resolution, is the health board. And we have an advisory group that hasn't interacted with us so much during the COVID time. So we're going to start bringing them in for quarterly reports to get more understanding of what they're up to and more involvement with their work and what we do in helping with the health department and just doing what we can to improve the health of our residents. So I look forward to that in the next few months. And other than that, I think we don't have anybody here for public comments on non-agenda items unless Ms. Bates, would you like to deliver? No. Okay. All right. I'll accept a motion in a second to adjourn.
So moved.
Stratton moves.
A second.
Chambro
Wallace
seconds.
Lewis seconds. All those in favor say aye.
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 We are adjourned.